Hi there. Thank you for hopping into our presentation today. We'll be getting started in just a minute. Good afternoon. My name is Mike Willett with the Intertribal Council of Michigan, and welcome to our webinar presentation today titled Blood Cancer Foundation of Michigan, Supporting the Social, Emotional, and Financial Needs of Patients and Caregivers Impacted by Blood Cancer Diagnosis. Your presenters today are Melissa and I'm sorry, Melissa. How do I pronounce your last name? Melissa Schultz.
Yeah, Schultz, actually. You're fortunate I changed my name.
There we go. LMSW, CNM, and ACSW with the Director of Patient Support with the Blood Cancer Foundation of Michigan, and Dan Layman, an MBA, the Community Liaison Manager with the Blood Cancer Foundation of Michigan. No commercial interest support was used to fund this activity. And if you have any questions during the presentation, please go ahead and type your questions into the Q&A box below, and we will go ahead and answer those questions at the end of today's presentation during the last 10 minutes or so. And now at this time, I will toss it over to Dan Lehman.
Thank you so much, Mike. Thank you so much to the Intertribal Council of Michigan for this opportunity to present today. We're very appreciative of everyone taking the time to participate in this webinar and to learn a little bit more about the impact of blood cancer on patients and families across Michigan. We're just going to start with a brief overview of our topics and goals for the webinar today. First off, we want to strengthen attendees' understanding of blood cancer, specifically talking a little bit about the types of blood cancer, treatments that are available, and data and a little bit of information on the occurrence of the various types of blood cancers across the population in Michigan. We also want to improve our attendees' knowledge of resources available for patients and the families who are facing blood cancer, specifically in our native populations, talking about access to services and resources to support patients and families with blood cancer. And then finally, we want to heighten awareness of resources, educational programs that are available for the tribal clinics and healthcare providers who are supporting Native populations and those with blood cancer. So with the goals outlined, I want to turn it over to Melissa, who's going to start our presentation.
Good afternoon. I'm going to spend some time talking about the main types of blood cancers. Please keep in mind that leukemia, lymphoma, and multiple myeloma are the three main types, but we do support nearly 200 types and subtypes of blood cancers and potentially malignant blood disorders. So many of those categories do fall under the scope of either a leukemia, lymphoma, or myeloma. But if anybody ever has questions about a blood disorder and whether or not it's something that we can cover, we would be glad to have that conversation with you as well. Just some statistics. Blood cancers do account for 10% of all cancer diagnoses. And in the state of Michigan, 18 people every day are diagnosed with a blood cancer. And that's almost $6,000, 6,000 people per year who are diagnosed. And then this is just a graphic that we often share with our community partners to give you an idea of some of the specific diseases. I'm not sure how clear this graphic is for you, but we will have this slide available as well if you're not able to see it. So you'll see that under the leukemia, we have 8 or 9 different types of leukemia that are very common. Lymphoma, we're going to be talking about the various types of lymphomas, but actually with the non-Hodgkin's lymphoma, there are nearly 70 types of non-Hodgkin's lymphoma alone. So obviously each of those individual diagnoses have very unique needs. And we work with the patient and the healthcare team to ensure that those needs are getting met. There's 2 main types of myeloma, and then there's also a variety of other blood cancers and disorders that don't necessarily fall into these categories. There's something called MDS, which you may be familiar with. That's myelodysplastic syndrome. Also, things like aplastic anemia are very common. So those would be some of the ones you may have heard of previously. So with leukemia, there are 4 main types of leukemia. There's 2 main acute leukemias and 2 main chronic leukemias. As I'm sharing this information, please remember I'm not a doctor, I'm a social worker. So I'm giving you a social worker's perspective on what this looks like. I would always ask you to defer to a healthcare professional for more medical information. Acute lymphocytic or lymphoblastic leukemia affects the white blood cells. These just don't ever mature into healthy cells. So they always stay immature and then they multiply very quickly and take over the healthy blood cells. This is the most common one in children. So often if you hear about children being diagnosed with leukemia, they typically do have ALL. AML is more common with the adult population. This occurs when there's actually a gene or a chromosome mutation, and the myeloid cells just don't form a healthy shape. So that's kind of just giving you a little bit of a medical understanding about what the difference between those would be. Acute leukemias tend to be very fast growing cancers. So when you're diagnosed with acute leukemia, you're typically hospitalized right away. You are beginning treatment immediately. There's not really a lot of time to sit back and think about what your options are because cancers, the blood cells are multiplying at a rate that really needs to be taken care of immediately. The chronic leukemias are a little more slow growing, which is typically called an indolent. It just means it's not moving as quickly as the acute leukemias are. CLL is actually the most common type of leukemia in adults, and that's when these healthy white blood cells mutate and crowd out other healthy cells. And actually, this is one of the few blood cancers where a family history can be more likely to cause a diagnosis in an individual. And then with CML, that is also most often in adults, and that's when the abnormal gene is converting the normal cells into the cancer cells. This is primarily starting in the bone marrow. So as I mentioned, these are both typically pretty slow growing. Often when somebody is diagnosed with a chronic leukemia, their doctors will put them in what's called a watch and wait protocol, which means their cancer is detected, but at the time that they're diagnosed, it's more beneficial for them to actually wait until their cells reach a certain count before seeking treatment. Causing treatment or receiving treatment prior to that can actually do more harm than good. And as you can understand, if anybody's been in that position where you have a medical diagnosis and you can't do anything about it, that can be an incredibly frustrating position to be in as an individual. And so with the Blood Cancer Foundation, we're really able to kind of offer a level of support to address those concerns that you may have. Lymphoma, as I mentioned briefly, there's 2 main types of lymphoma. There's the Hodgkin's lymphoma, which is an acquired genetic disorder. So these basically are when B cells are mutating. They're larger than normal cells and they multiply faster. And so they're actually attracting blood cells to the lymph nodes. So that's why, it's a disease of the lymphatic system. Often people who have lymphoma will end up with swollen lymph nodes in their glands. Often that's how people are diagnosed, is they're going to say, oh my gosh, all of a sudden I have this huge lump on the side of my neck and I'm not sure where it came from. They go to the doctor, they're biopsied, and they learn that they do have a lymphoma. They are most common, actually, interestingly, in people 20 to 39, so a young adult population, and then again in 65 and older. So that kind of like mid-age population is not a frequent diagnosis age range for people with Hodgkin's lymphoma. And with non-Hodgkin's, as I mentioned, there's more than 70 different types of non-Hodgkin's. They're also occurring in the lymphatic system.
and they're mutating, becoming tumors. Because there are so many different types, it's very difficult to generalize them, but some are very slow growing, some are very fast growing. Some can be managed with a very short course of chemotherapy and or radiation and go into remission indefinitely, where other types may go into remission for a year or 2 years or 5 years. But ultimately, the patient will end up relapsing again and will need to seek either the same course of treatment or an additional course of treatment to get back into remission. So, as I mentioned, there's so many different types of the non-Hodgkin's lymphoma that each has their own unique characteristics. And then lastly is myeloma, and broken down. Most of the time, if you hear myeloma, you're going to be hearing multiple myeloma. This is when the plasma cells are mutating and producing abnormal antibodies. So somebody who's diagnosed with myeloma, their doctors are going to be looking at their M proteins. It does affect men more than women, and older African-American men are actually more affected than any other population with that. There are also 2 types of myeloma called plasmacytoma and amyloidosis that are more rare. We do have actually patients on our service right now who have both of those diagnoses, but most often if you hear somebody saying they have myeloma, they have been diagnosed with the multiple myeloma. And often people will say, well, if these are so common, what are symptoms that I should be looking for? The difficult thing is because blood cancers, obviously your blood is circulating through your entire system. So you're not getting necessarily like a concentrated symptom in one area. Often these are pretty generalized symptoms that just aren't going away, or they're compounded with one another. So people often get extremely fatigued, have a fever that just does not go away, are bleeding or bruising pretty easily, and finding that, those bruises are staying around a little bit longer than they normally have in the past. Or I cut myself and for some reason, my blood just isn't coagulating the way it has in the past. Little things like that. Frequent infections, people who maybe are constantly sick, even if they're having colds or, things like their immune system is just constantly struggling to keep their bodies healthy. As I mentioned, the swollen lymph nodes. And then also because a lot of blood cancers do form in the bone marrow, people will say that they've noticed bone pain. A lot of times that is happening like in the hip area, because that is one of the main areas where bone marrow is regenerated. But obviously, because these are general symptoms and could describe probably 500 other diagnoses, the best thing is to just get a blood test from your doctor. They can do it very simple with, what they call the CBC. And then if they find any abnormal blood cell levels, they may follow up with like a CT, an MRI, or a PET scan, and then potentially a bone marrow biopsy. And if you're not familiar with what a bone marrow biopsy is, they actually just will go in, like I said, typically in your hip bone area, because that's where you have a high concentration of bone marrow cells. And they just take out a small sampling of the bone marrow cells, and they'll take a look at them under a microscope and assess, the cell counts and determine whether there are blood cancer cells in your bone marrow. And beyond that, after somebody is diagnosed, one of the really, I think, interesting things is there have been so many new treatments for blood cancers in the last 10 years. And I think because there are so many different types of blood cancers, one thing that researchers are finding is they're finding something that works really well for one type of blood cancer. So then they're testing it on other types and finding a lot of successes as well. So it's really exciting from the treatment perspective to see all of the new things that are kind of coming down the pike specifically for these blood cancers. The first line therapy is always chemotherapy. Well, I don't want to say always, but most of the time they're going to be going to chemotherapy. And that's where they're just using different combination of drugs to slow down or eliminate the cancer. Radiation therapy is also extremely common. So often that's either targeting abnormal cells in a specific area. It may be on the lymphatic system. It may be on the entire body, in the brain, in the spinal fluid. And often that radiation does accompany chemotherapy or a different type of therapy. And then the immunotherapy is really interesting and something that's fairly new. And that's where doctors are actually able to take your own immune system, kind of modify it, put it back into your body, and it will fight your own cancer cells. So that's, definitely more groundbreaking. And the targeted therapy, that's where they're actually going in and changing your genetics and altering, specifically, for example, lymphoma, as I mentioned, a lot of those are genetic mutations. They can go in and alter that gene mutation to essentially take it away and fight that cancer so it's not going to come back. CAR T cell therapy, that's where they're actually taking, they're called chimeric antigen receptors for anybody who is really interested in what the CAR T stands for. But they're turning those T cell lymphocytes into a treatment. So CAR T is typically more of a like third line or last resort type therapy when other things don't work. And that's because it takes a lot of time on the effort of the doctors and the medical team to actually implement this process where they're converting these T cells. And it is prolonged, so it's not something that can be immediately administered to somebody who has a more aggressive type of blood cancer. And then you've probably heard of the bone marrow stem cell transplants. There are two types of transplants. One is called allogeneic and one is called autologous. Allogeneic is when you're getting another person's bone marrow donated to you, and autologous is when you're actually using your own bone marrow to transplant. So they're treating it, they're removing all the cancer cells and putting it back in your body. And these have varying success rates, but actually it's a pretty common form of treatment when chemotherapy and radiation regimen does not work. And so I am going to be showing you some statistics, and I want to give you a little bit of explanation with these, because often the charts don't thoroughly explain the data that's really there. So, for example, with this Hodgkin's lymphoma, you'll see that with their population where they have the non-Hispanic American Indian / Alaska Native, they don't have any data points here. So this may look to you like in 2000, there were hardly anybody diagnosed with Hodgkin's lymphoma, and that number has been increasing significantly. What's really important to look at is actually, if you look at, this is through the SEER website, which we will have references at the end. They have a little asterisk that says rates for American Indians / Alaska Natives only include cases that are in a purchased / referred care delivery area. So when SEER is gathering data on diagnoses and treatments and survival rates and things like that, they're working with a core group of partnering healthcare systems. For this particular population, they didn't have a healthcare system that they could effectively track ongoing data points for, which is why there's a line there, because they've acquired the information from third-party organizations that aren't necessarily, that they haven't been tracking it themselves. So you'll see that they were able to kind of look at the trends based on information they've obtained from other organizations or other healthcare facilities, but have not directly obtained themselves. With leukemia, very similar. You're going to see that there's a smattering of kind of data points all over the place. And once again, this looks like the number has increased significantly. But historically, as you'll see in the last 20 years, if they're only working with a small percentage of large healthcare systems, and you have populations that don't live within a reasonable distance to work within these healthcare systems, you're not going to be getting accurate data. So likely what this chart is telling me is that it's not that the American Indian population has suddenly had an influx of new diagnoses. It's that maybe more people are going to these larger healthcare systems that weren't able to attend to them in the past 20 years. They're able to gather more data, or more healthcare systems are now participating in the SEER data studies, so they're getting more accurate information. So, it may look, when you first look at this and say, oh my gosh, like, why is the diagnosis rate for leukemia growing faster than any other ethnicity? And that's not necessarily, you can't always take that at face value. So please keep that in mind as you're looking at this information. Myeloma, as I mentioned previously, you can see the trend that it's more common in the non-Hispanic and Black population. And that has actually also been increasing. Very similar. The participation rates in the 20s or in the early 2000s just weren't as significant as they are 20 years later. More people are a little more comfortable, having a little more trust in the healthcare systems, and utilizing those larger systems where that data is being tracked and monitored a little bit more closely. And then also just looking at the non-Hodgkin's, you'll see once again these data points specifically for this native population is they're much more varied than all of the other ethnicities. And that's because they just have not had consistent reporting information coming from the healthcare systems that are serving these unique populations. And then looking at survival rates, so I think it's always important to show not only how you're diagnosed, but then what are the long-term effects. So one of the things you'll probably notice on all of the charts, which, I'm not going to necessarily have to talk you through, I just think it's important for everybody to see this information, is that you'll see that there's this kind of bar here, specifically in this American Indian Native, Alaska Native section. And it's much bigger than all of the other colored bars that are there. That kind of eye-shaped bar is a variance bar. And so that means that they're doing a little bit more estimating for those numbers than they are for other populations. Whereas the non-Hispanic white, they have a lot more data to go off of. So it's much easier for them to have a higher level of confidence that, this 5-year survival rate is roughly 85 out of 100. Whereas with, some other you can see how kind of the Hispanic, it gets a little bit bigger, the Black population gets bigger, and then this Native population, obviously there's a lot more estimating that they have to do because they just don't have the confidence level in the data to say that this is 100% the information we're looking at. So as I show you all of these, you'll see that that's pretty consistent across the board, that I don't think it's surprising to anybody that we have more data on white patients than we do any other population. I think we are going to talk just a little bit about the resources. And Dan, I think this is where you were going to take over, right?
Yep. Thank you, Melissa. Right. I wanted to talk, specifically about some of the resources that we offer. Blood Cancer Foundation of Michigan has been supporting patients and families nearly 75 years now. We were founded as the Children's Leukemia Foundation back in 1952. And recently, I would say about 7 years ago, we changed our name to the Blood Cancer Foundation of Michigan, really to represent all of the types of blood cancer that we support, as well as really supporting anyone at any age, children and adults. And really what we try to do is provide comprehensive and holistic support to anybody in our state who is facing blood cancer. And really all that's needed for enrollment is a diagnosis of blood cancer, and person lives in the state of Michigan. We help about 2,000 patients at any given time across the state. Roughly about 80% are adults and 20% are pediatric patients. I want to touch on the primary. Sorry, I'm still back on that resources for blood cancer. There we go. Got it. All right. I want to touch on the patient support specialists. These are our primary staff who are helping and supporting our patients and families on any given day. These are master level social workers and counselors, and they are the ones who really are the point person for our patients and families, and they provide or obtain resources in 3 primary areas: emotional support, being present to help our patients navigate the roller coaster of emotions, from the shock of diagnosis to the anger of having to experience a diagnosis to the hope of being cancer-free one day. We also will provide financial assistance or support. There's just when anybody is diagnosed with a blood cancer, they immediately begin facing or begin living above their means, because no matter the income level, our patients often face denial of insurance coverage. They're lost wages, being unable to work, or seeking treatments away from home. These all are factors that make it very difficult financially for someone going through blood cancer. And with all this coupled with rising healthcare costs, cancer patients are about 3 times more likely to have to declare bankruptcy than the average person in this country. So it's a real important area for us to be able to support. And finally, we offer social engagement opportunities just to help people feel less alone. And I'll talk more about those in a minute, but Melissa's going to first talk about emotional support.
So emotional support is actually really the crux of what we're offering at the Blood Cancer Foundation of Michigan. And that's because we know that blood cancer doesn't discriminate. So it affects everybody in a very different way. Even if 2 people with very similar backgrounds are diagnosed with the same type of blood cancer at the same time, it's going to affect them completely differently. So we do have a team, as Dan mentioned. All of our patient support specialists are master's level professionals who are specifically educated in the needs of blood cancer patients and their families, because when a patient is diagnosed, we understand that it does not just affect the patient, it does affect the entire family. And I know Dan will talk about this a little bit more with our social service programs, for example. But that means that if somebody enrolls on our service and the spouse needs to be the primary contact because they're struggling more than the patient is, we can absolutely do that. If it's the parent of a pediatric patient, we can support them as well. If it's an adult child of an adult patient, really it's whoever needs that ongoing level of support, we're able to provide that for them. And we customize that to every individual who signs onto our service. So when they call us or we call them to enroll them, we're assessing for what their individual needs are, and then we're determining a care plan for that individual. So primarily that is done through the phone because we are a statewide organization. We currently have patients in 80 out of 83 counties. And so we just can't get to all those people in person. So the phone support is typically the best and most convenient way for our families to stay in contact with us. Some patients may say, I'm really struggling. If you could call me once a week, that would be fantastic. We can definitely do that. Whereas further down the road, they may say, once every couple of months is fine. Or even patients who have been on our service for years and years may say, I just really appreciate a check-in phone call once a year just to know you're still thinking about me. And if anything comes up, I can take advantage of it. The other thing that we do is we partner with a lot of other community organizations. So there are a variety of different nonprofits that we collaborate with. We partner with Cancer Support Community of Greater Ann Arbor, and we facilitate a virtual support group for blood cancer patients. That's a monthly drop-in group. So, you do have to just sign up to get the link to access it. But what's great about it being virtual is we have people from all over the state who are joining us for that group. And it's really nice just for them to be able to offer that level of support to one another and get that support from one another. We partner with organizations like Gilda's Club and Camp Casey, which does horse, visits for families, and a lot of financial support organizations, because we know that it is a community effort and we can't do it alone. And we want to make sure that we are all working to ensure that these patients are getting the best level of care that they can during this time.
Right. I'm going to talk a little bit about our financial assistance resources. We really want to provide relief, especially as medical bills can be piling up and expenses accumulate related to blood cancer. one statistic I like to share is that the average out-of-pocket cost for blood cancer patients in the first 12 months is almost $4,000. This is out-of-pocket. Obviously, something that patients and families aren't planning on. And so oftentimes our families face really difficult struggles or decisions between paying for daily necessities that they need for daily living and cancer care. And so our patient support specialists work really individually with each of the patients, with the families, and try to provide some financial support, some financial guidance. One of the ways we do this is with our patient reimbursement fund. We'll help with things like travel to and from clinics, doctor's appointments, helping with prescriptions, co-pays, over-the-counter medications, up to all those things that might not be covered by insurance, up to $500 in a year. And as part of that $500, we'll, like I said, reimburse for travel up to 18 cents per mile. And that really adds up for our patients who are needing to travel long distances if they're in more rural communities. So that's a really important way we can help people get their access to care and get the treatments that they need. And another part of it is working with other community organizations that we can help develop financial roadmaps or provide access to our patients and families to resources that might be available in the community to help them financially. Going to social and community support. So I think we mentioned that there are at any given time in the state of Michigan up to 6,000 individuals who are being informed or told that they have a blood cancer. And so there's a significant population of people that are facing blood cancer, but oftentimes going through it, you can feel really isolated, you can feel alone. And so we try to create space and events for meeting other people who are facing blood cancer that you can relate to, that are facing the ups and downs of day-to-day treatments and survivorship, and wanting to provide space for people having fun. So we'll offer gatherings or outings that are free. They're always free. Some of the things we've done are hosting informal painting classes for our families to come together, or an outing at a trampoline park so the kids can have fun and get out. But in addition to that, we'll give away tickets to sporting events. We'll give gift cards out for local restaurants. So a family or a couple can just go out and have a meal and take a break from the rigors of their blood cancer. Movie tickets and passes, really trying to tailor it to the local community and just providing those chances to get out and to take a break. I also want to mention our Holiday Toys program. This is a program where we fulfill gift wish lists for our pediatric patients and their siblings, as well as the children of our adult patients, upwards of $100 in gifts and gift cards for our teens. We don't even want to try to shop for teenagers. You can all probably relate to that. But we provided upwards of 750, we've provided gifts and gift cards for upwards of 750 children last year as part of our Holiday Toys program. And this is one of the most impactful ways that we can help those families who may not be in a position financially to be able to shop, for toys or for gifts, or they really struggle to be able to find the time to get out and to shop for gifts. So this is one way that we can do that, and something that we can share more information with everybody on this call to be able to participate. All right, and then I wanted to talk about heightening awareness of the resources that are available specifically for education for those within the tribal clinics or healthcare providers that might be seeing patients with blood cancer. We have a whole library and an array of resources, again, really wanting to tailor the specific need of the clinician in the tribal clinic or the healthcare provider in meeting your patients and families where they're at. I'm just going to hold them up, and we'll have these all available as part of the webinar library. But this is our program guide for referral sources. This really is just a piece that helps cover eligibility for our programs, what medications might be covered, and just a roster or listing of our patient support specialists in ways that you can contact them. This is our, the supported diagnosis poster is on slide 4 that Melissa shared in the beginning of the webinar. I don't have the hard copy here, but that just lists all of the diagnoses that we support. And there are over 200 of those. This is our, let's see, I'm going backwards here. This just overviews our different programs in each of the areas that we talked about: emotional support, financial support, and social support. We have a card that is available for patients and families to put in the mail if they want to receive more information about our programs and services. And we'll follow up with them once they make that request. Melissa mentioned our support group, the third Thursday of the month, virtually. This is another resource that we can share with everybody, but that's available for folks. And then a flyer on our holiday toys program, which is available to anybody who's admitted throughout the year, but that's mainly over the holiday period in November and December. Oh, and here's this is the postcard I was talking about there. And that is available for anyone who wants to request more information about our program. And we want to be able to, continue ongoing dialogue, create opportunities for learning, for support. So I just want to offer that we're available for visits to the tribal clinics, and just be there to provide information, resources in any way that we can, opportunities for learning. If people wanted to engage in coffee break discussions, I know the clinics are very busy places and seeing a lot of patients and a lot of activity. Just taking a break during the day to share a cup of coffee and talk a little bit more about our services or the diagnoses that we support. We're available to do lunch and learns and come out and talk over lunch and just, again, provide some more opportunities to learn about the resources that we provide and the people that we can support. Yes, that covers it. Do you want to talk about the content?
I just wanted to share the citations for where those charts came from that I showed you earlier. So if you are interested in doing a little bit of a deeper dive into some data, if you're one of those people who loves data, then these are the sites where that information was taken from. And at this point, we would love to answer any questions that anyone has.
Does anybody have any questions that they want to come off mute for and ask? not seeing any in my chat. Mike or Beth, are you seeing any in the chat that I might be missing?
I do not. However, if folks want to type any questions into the Q&A box, they're more than welcome to do so. Being the webinar platform, I think that all the attendees are muted. But if anybody wants to type their questions into the Q&A box, they can do that.
I have a question. Can you talk a little bit about how you would serve tribal communities in northern Michigan, with the like you said, they have the opportunity to support families at the holidays or in outings, because we find that with other organizations, all the activities are centered in the urban areas like Detroit, Lansing, Grand Rapids, that type of situation.
Yeah, that's one of the things, obviously getting into the communities, that's something that every year we're working really hard to do, because we feel like it's unfair to say we offer services in every county of the state, except the county that you live in. So a lot of what we will do is, if there aren't people, a lot of the counties, for example, in the UP, we may have one patient. I think right now we have like 4 people in Marquette. So what we're doing is we're offering gift cards, for example, to say, hey, there's this great, if you have kids, there's a great like putt golf center, and we'll buy you gift cards for your family to go out and just enjoy this activity without having to worry about the cost. Or I use Marquette as an example just because we've had a lot of success and opportunities there, where we've worked with like the Aubrey's restaurant, and they've donated gift cards, and we'll partner that with some movie theater gift cards to give your family a dinner and movie night out. So you may not necessarily get the same experience as, like you said, Metro Detroit, where we're having events where 200 people are attending. But what we want to make sure is that we're still offering you the opportunity to get that kind of experience, because we know for that, it's just as expensive. Blood cancer is just as expensive regardless of where you live. And sometimes it's more expensive if you're in a more rural area and don't have easy access to transportation or things like that. For the toy program, that's open to anybody throughout the state. We actually typically ship those through UPS. So while we do offer a couple larger events where people can pick those up, that's something where, it's not exclusively to a certain religion. It's not exclusively to a certain demographic. It's just, if you have children that would benefit from toys in around the December holidays and they're 18 years or under, we can provide those for you. So we don't really have a lot of tight restrictions on that. We want to make our services as accessible as possible, regardless of where you live in the state. It's the same with like our reimbursement program. So for example, all we need to do to reimburse you for travel is just see evidence that you attended an oncologist appointment on that day. And that can be as easy as, if you have a social worker you're working with, we can contact them directly, so you don't even need to do anything. Or if you're using an app that has a list of all your electronic medical records, you can give us an access code and we can go in and we can fill that out and submit that on your behalf. So we really want to work to make things as easy as possible for you to access. So it's just one less thing you have to stress out about.
Thank you.
I'm not seeing any more questions in the Q&A. I do have one more question. Where is the easiest place for people to access all of your information? Is it your website?
Yeah, our website, which I will actually share with you right here. This has our website on it, as well as our 800 number, so anybody can call if they want to get information. Our website does have links to both register for services or to fill out if maybe you're not quite ready to sign on to our service. You just want to find out what we have to offer and if it would benefit you or your family. There is that info card that Dan showed you the physical copy of. We actually have an electronic version that you could submit as well. Whenever you submit a request through us, we follow up within 2 business days. So you can always expect to get a response pretty quickly from one of our team members.
And then the other thing I wanted to point out is, as we're talking about like the emotional support, when you enroll on our service, you are working with one dedicated staff member during your time on our service. So we're not one of those organizations where it's whoever answers the phone is going to be, you know, addressing your needs. You're building a relationship. And that person is going to get to know your unique needs so that when a resource comes up, they can reach out to you and say, hey, just want to let you know this financial fund just opened and I thought this would be beneficial for you. So we want you to have that constant support for as long as you need it. I think Dan had mentioned, we don't ever discharge people from our service unless they move out of the state or they tell us they don't want to hear from us anymore. So the average person stays on our service for just over 5 years. But we have individuals who, you know, their child was 3 years old when they enrolled on our service, and now they're in college and they still come to our social events. So we don't, I mean, we're building a community and we never want to kick you out if you're benefiting from it.
Thank you for that.
Yeah, Miigwech. We really appreciate it. Well, on behalf of Intertribal Council of Michigan, we wanted to thank you, both Melissa and Dan, for your great presentation.
And
Thank
we
you
will,
so
yeah, and we're gonna post this on our YouTube channel and advertise it out to the tribal clinics. We had some that couldn't attend because of patient load.
Hmm.
But we'll share this with them and they'll have the recording. So thank you.
Wonderful. And please reach out to us with any questions at all.
Thank you very much, everybody. Again, yes, this will be archived and we'll be able to share it out with everybody. And we want to thank Melissa and Dan for presenting today. And with that, we say thank you very much and have yourselves a great day.